Welcome, and thank you so much for joining me today as we discuss this immensely important subject of our student mental health. My name is Jody Goodrich. I'm a licensed marriage and family therapist, the former mental health coordinator for the Fullerton School District, and I'm currently serving as a contractor for the district, overseeing their pre-licensed mental health staff. So thank you so much, and again, this is a serious topic we're discussing today, so feel free to sit down, relax, get yourself a soda, take a deep breath, and know that we're all in this together. Why are we talking about student mental health today? Well, I'm sure many of you are aware from the news and current events that we are in a mental health crisis in our country currently. Unfortunately, some of our most vulnerable victims of this mental health crisis happen to be our youth. This pandemic that we're still barely coming out of really set us back from a mental health standpoint. Kids were expected to adapt to an unprecedented and highly irregular event, and we felt it as adults, and our vulnerable youth felt it even more so. So we wanted to assure you that as a district, we are prepared to handle all the mental health crises that may be present in our student population. We're able to do that because mental health has been a priority for the Fullerton School District for many years now. And I'm so pleased and proud at the robust mental health staff that is employed by our district. As is presented on the screen currently, we have over 42 mental health professionals that are willing, ready, and able to come to the aid of our students. This number continues to grow every year. All of our professionals who deal with our student mental health have a minimum of a master's degree. Many of them go on to receive professional licensure or on their way to receiving a professional license. Others have credentials through our school board systems and are serving as social workers, counselors, marriage family therapists, and professional clinical counselors. It's a robust team, and I'm so happy to say that we are able to support all of the needs of our students. Just last year, we saw over 1,017 students in counseling sessions who were having a crisis of some sort or demonstrated a need to talk to a caring and safe adult about something that was troubling them. Overall, and during our last school year, we conducted over 11,035 counseling sessions. That is an overwhelming number, and it does continue to grow annually. So what are the types of supports that our school district is able to offer to our students? Well, we use a tiered system, meaning we go from the supports that all students can benefit from to some very targeted and intensive supports. We start our supports in a universal fashion where all of our teachers are now able to provide lessons in social emotional learning due to the wonderful second step curriculum that the Fullerton School District has adopted, where all students learn how to cope with difficult emotions, problem solve, build resiliency, have better friendships, and overall seek to have better mental health through these lessons. Additionally, all of our 7th graders are given a Signs of Suicide presentation. This is a very important presentation for our incoming junior high students. They learn how to acknowledge and understand any signs that could lead to someone considering attempting suicide. They also learn how to reach out for help, and they learn how to reach out for help not only for themselves, but if they have a friend, a fellow student in need. Each student is screened after this very important presentation, and we're able to talk to those students who may be feeling unsure whether they're at risk of having a mental health crisis. We also have student screening by all of our teachers twice a year. Students will be monitored in their classrooms, and our teachers will be filling out screening forms which alert our mental health staff to any students who need a particular intervention. This is done again twice a year, and it's a very important tool so that none of our students go under the radar. And finally, on our junior high and K through 8 campuses, there are very helpful QR codes for our very tech-savvy student population where they can simply scan the code and immediately get on a list to see the counselor. Those are supports that are available for all students, but sometimes students need more. And so we also offer targeted supports. These are things like check-ins, where a caring mental health professional will check in on a student who may have exhibited some signs that they need some extra support, or they have reached out to the counseling team. We also have targeted social skills groups to help kids manage with difficult emotions like anger, aggression, withdrawal, not being able to manage peer conflict. All kinds of social groups are in play as I speak throughout our Fullerton School District. We have lunch bunches for those kids that just may feel a little alienated during those big social times throughout the day. Those are wonderful ways for kids to learn how to connect with others and build lasting relationships. We are continually screening any student who's exhibited warning signs of having a potential plan to harm themselves or others for that matter. Those are licensed professionals, and our pre-licensed professionals are all trained in monitoring these students to ensure that they get the proper support and follow through if anyone is at risk. And all day, every day, we are equipped to make outside referrals for more intensive counseling. Most of our issues that we deal with at school, we would consider school-based issues, things that are hindering a student's ability to access their curriculum or their social engagement. Any other issues that are being exhibited on our school campuses, we refer those out for intensive outside counseling. And then finally, we have our intensive supports. There are some students who may need a particular level of counseling at the school site that is more intensive and maybe longer in duration than a check-in periodically. For these students, we can offer individual counseling, which is absolutely given on a needs basis. This is for students who have exhibited some signs and symptoms of having an issue that is affecting them at school or socially. And really, our counseling services at the school level are skill-based services. We want to equip our students with coping skills, with problem-solving skills, conflict resolution skills, and that can be done in individual counseling. It can also be done in group counseling, where it is a more psychoeducational form of counseling, where students learn skills together in a group and are able to practice them with each other while having a skilled therapist and counseling professional help them navigate. Also, we do crisis intervention. If any of our students are involved in any type of crisis event, if any community crisis, global crisis happens that impacts our student body, our professionals are able to intervene on our students' behalf. And then we're continually consulting with any outside providers that are providing services to our students so that we can ensure that what is happening at school and what is happening at home, we practice a continuum of care that enables us to know everything that that student needs and everything that that student is being delivered by an outside therapist. Well, now we're going to talk a little bit about some of the things that you might be concerned about as a parent of a student in our district. Anxiety is something that we've seen increase dramatically. And again, as I mentioned, when students are experiencing something unprecedented like a global pandemic, it is no wonder that we've seen an uptick in anxiety. So please know that nervousness, feeling a little uneasy from time to time, maybe feeling outright anxious from time to time, these are all normal feelings. We all feel this way sometimes. But we want to be alerted that when these signs are lasting longer than, say, a few weeks, and if they're really interfering with a student's daily living, then it's time to take notice. Again, signs of anxiety, we all know them. It's a persistent feeling. It may cause restlessness, being on edge, wound up. Sometimes students will be easily fatigued because they're just hypervigilant and it's exhausting. Maybe they're having difficulty concentrating or they're irritable. They may have somatic complaints, headaches, stomach aches, unexplained aches and pains. They'll have a difficult time controlling their fears and worries, and usually they'll have some sleep problems, maybe difficulty falling asleep or staying asleep. Again, if these symptoms are lasting for more than weeks, and if they are interrupting with your students' daily living and the things that they enjoy, even absent a stressful event, that is time to seek outside counseling. Another serious mental health issue that we've seen increase is depression. Like anxiety, we all have days when we feel blue, we don't feel ourselves, and it might be difficult getting out of bed. Certainly a lot of students that were home and weren't exposed to their normal daily routine did lose some interest in some of the things that they used to because they weren't able to do it for such a long time. But hopefully everybody has come back around and are enjoying the things that they used to enjoy. But we've had some students who are still exhibiting these symptoms. They're feeling sad and anxious, maybe worthless, empty inside. Again, losing interest in things that used to be fun is a huge warning sign. Hobbies, sports, things like that, those are signs that there's something wrong. If a student is feeling easily frustrated, irritable, or angry, that can be a symptom of depression. Withdrawing from friends and family, having declining grades and losing interest in school, changes in sleeping and eating are always signs of depression, fatigue and maybe even memory loss, and then finally, thoughts of suicide or self-harm. Like anxiety, we understand that we all have off days. But if these symptoms are persisting for longer than 1 or 2 weeks and they're interfering with daily life, it is time for you to seek outside therapy for your student. Self-harm is something that parents are very alarmed by, and it is very alarming. I will just preface this by saying that self-harm, as well, it may look like someone is really trying to hurt themselves and possibly attempt suicide, it's usually not the intent of someone who engages in self-harm. Many students might cut themselves, scratch themselves, burn, give themselves abrasions, and this is really intended to sort of drown out psychological pain that a student might be feeling. Medical science says that when we harm ourselves, it releases endorphins into our bloodstream that actually might give a pleasurable effect. And it's no wonder that students who are feeling psychological pain would engage in this behavior if the pain, a psychological pain, is becoming too intense. But again, we really need to look out for this. This is a big warning sign. It's saying something is not feeling right. And usually there will be signs of depression that accompany this. Self-harm requires treatment by a clinical therapist, just like anxiety and depression. Now finally, we're going to talk about suicide. And I know this is a serious and very unpleasant thing to think about and even talk about. But if we don't talk about it, we won't know how to deal with it. And we absolutely have to know how to deal with it. I will start by saying that there is usually not one thing that causes someone to take their life or attempt to take their life. It's usually multiple factors. So right now, we're going to be educated on what are those factors. Certainly, many students are already at increased risk for attempting or completing suicide. And those would be students who do have a personal or family history of mental illness. If a student has made a previous attempt to take their life, that is a big risk factor. Any use of alcohol or drugs will lessen students' inhibition and their ability to make a good choice, so that is always a risk factor. Anyone who has a significant loss, that is a risk factor. And if any student has a history of a family member or friend dying by suicide, that is linked with an increased risk for suicide. Anyone who's exposed to bullying, violence, abuse, that would be a risk factor. Having access to lethal means, that, as we've seen so often in current events, that is a definite risk factor. Personal or family relationship problems is a risk factor, as well as gender and sexual identity issues. So it's important that we know that students who have had any or multiples of these issues, that we are very hypervigilant in making sure that we keep our eyes on them so that they don't get into trouble. So if we have risk factors, that's one thing, but that doesn't mean because someone has a risk factor that they're going to attempt suicide. There usually are some warning signs, not always, but most of the time. And that can come in 3 different ways. We can have a student talk about committing suicide. We can see it in their mood, or they can behave differently. So certainly we've heard students maybe talking about the unbearable pain that they're experiencing, feeling trapped, wanting to not be a burden to others, or actually saying that they want to kill themselves. If they're not talking about it, maybe we can see that they're just depressed, they've lost interest in everything, they're irritable, rageful, possibly humiliated. And then we might see them doing high-risk behaviors. They may be sleeping too much, they may be acting restless or aggressive, or calling people to say goodbye, giving away their personal possessions. These are all things that we want to make sure we're aware of, so that if we see this happening, we make sure to get this student help as quickly as possible. Well, the good news is that while there are risk factors and while there are warning signs, there are protective factors. And these are things that would help a student never want to make that choice to harm themselves. These protective factors start with overall resilience, and that's why our social emotional learning lessons are so important, so that our students are learning how to cope with difficult situations. Also, good problem solving skills, that definitely is a protective factor. If I've got a problem, I'm going to solve it, and that's a great thing for a student to be able to do. By virtue of you watching this video, now you know that there is help. There's help at the school site, and there's help outside. And my partner from CareSolace, Tyler, will be talking to you later in this presentation to tell you just how you can get the help that you need. Cultural and religious beliefs that discourage suicide are always helpful. Positive peer relationships. When our friends have good friends, they feel safe, they feel protected, and they feel cared for. So having good friends is absolutely a protective factor, as well as interpersonal and community connectedness. The more our students belong at school, belong to groups, belong to their family, belong to our communities, the better off they are. Creating safe environments is our priority at the Fullerton School District. We want all of our schools to be a safe place for kids to come and to feel protected and cared for. And at home, that is needed as well. The safer our students feel, the better they are at making good choices for their life. And possibly the most important of all, as in the protective factors, is positive adult relationships, and that starts with moms and dads. When we have a wonderful, caring home life, we are absolutely protected from wanting to harm ourselves. When we know that we can go to mom or go to dad anytime we're having a difficult feeling and we're heard empathically with care and love, that's the best protective factor of all. So I encourage you all to take some time today, this evening, to really tell your kiddo how much you care about them and encourage them to come to you whenever they're having a problem that you won't judge, you won't be mad, but you'll listen and you'll help, and you'll get them the help that they need. Regarding suicide, I want to assure you that all of the professionals that I highlighted at the beginning of this presentation are trained in a very thorough suicide risk assessment protocol. Anytime we hear of a student who's having some distress and possibly talking about harming themselves, one of our mental health professionals sits with them, cares about them, and connects with them first and foremost, and then conducts a thorough suicide risk assessment to determine the level of risk, if any. All parents are notified when this process culminates, and we follow through with any sort of care that's needed after the fact. So what can parents do to ensure that their students are safe? Well, you're doing it. You're becoming aware that suicide is a real problem, and you're learning the warning signs, and you've been told to please listen and validate your students' emotions. It's so important. It's important also to use the word suicide or kill yourself because we want to be very clear what our children are talking about. We want to seek professional help right away, and my partner will be helping you know just how easy that is through our partnership. You always want to stay connected with your kiddo. They may have a bad time, they may be in crisis, but you want to follow up with them. You always want to stay connected. Again, it's important to remove any harmful means. If our students are exhibiting any of these warning signs or risk factors, we want to take away anything that they could harm themselves with. And finally, we want to keep this conversation going. This isn't a one and done type of thing, mental health. This is ongoing, and for many students, it can be an ongoing battle. So we want to assure our students that we're in this with them. They're not alone, and we understand, and we want to give them the help that they need. Thank you so much for joining me today. And now I'm going to turn it over to Tyler Chomness, our representative from CareSolace, who's going to tell you all about their wonderful services and how you can connect to counseling.
Hi, everyone. My name is Tyler Chamness here with CareSolace, and today I'd like to talk about our partnership with Fullerton School District. First, I'd like to start with a little bit of background. CareSolace was founded in 2017. Our founder and CEO, Chad Castrita, found that through his own personal experience with seeking help for mental health, for addiction, when he hit his bottom and was ready to get help, it was really difficult to get connected to a quality provider, and he ended up having a bad experience with a provider, and he realized that there was a gap in the system. So eventually he found his way. He got well, got his master's from USC, and then launched CareSolace in 2017. Now, everyone at our organization has a personal connection to this mission in one way or another, myself included. At a young age, I experienced grief and loss, and I didn't know how to deal with those emotions, didn't know who to talk to or where to go. And I leaned on drugs and alcohol to cope with those emotions, becoming depressed and suicidal myself. And I could have used something like CareSolace that would have saved a lot of pain and trouble and time, which is why I'm so passionate about helping others get connected to care. And I just share that to let you know that this is personal for us and that it is a mission driven organization. But CareSolace is a 24/7 mental health care coordination service that is really on a mission to calm the chaos of the mental health care system and break down any barrier that might prevent someone from getting connected to care. Currently, we are serving over 4,500 schools across the country, both K through 12 and higher ed. Over 4 million students have access to our service, but when we partner with an institution like Fullerton, the service is not only available to the students, it's also available to their families. It's available to the staff and the staff families as well. So universal access throughout the sites. And because of that, over 13 million people have access to the service currently. Last school year, we saved schools and families over 400,000 hours in care coordination efforts. Now, the reason why we're doing what we're doing is because, as some of you may know, navigating the mental health care system on your own can be a little bit chaotic, a little bit overwhelming. And these are just some of the challenges that can get in the way of someone who needs help. getting the help that they deserve, whether it's the stigma of reaching out for help, long wait times, navigating insurance, language barriers. We have put this system in place to really hold your hand through the process, to break down those barriers on your behalf, and again, to calm the chaos of the mental health care system. And we're able to do that through two primary pathways of care coordination. Care Loop is an internal dashboard where school-based counselors, social workers, psychologists can refer families directly to Care Solace, and then we'll keep them in the loop throughout the timeline, throughout that care coordination process, through that dashboard. But what I'd like to focus on today is Care Match. This is a self-serving component. Fullerton has your own proprietary link that I'll show you where to find and how that works. And it allows all stakeholders of the district, so students, families, staff, family, to anonymously and confidentially get matched up with providers that meet their specific needs for both mental health and substance use, and the ability to do that from the comfort of your home. But all roads lead to the care companions here in the middle. They really are the heart and soul of Care Solace. These are individuals who are dedicated to helping families get connected to providers that meet their specific needs. And they are really a workhorse for your community because they're the ones who wait on hold, who check availability, who navigate insurance, and make sure that providers specialize in the specific needs of the family. They'll do all that vetting for you. They'll help to schedule the appointment and follow up afterwards to make sure that it's a good fit. So you can contact the care companions directly via phone, email, video chat, but they can also be contacted through these two pathways of care coordination. They are available 24/7 and they can accommodate for over 200 languages, as we do not want that to be a barrier. All right, so that's the overview that I wanted to give you on Care Solace. And now I'm going to switch my screen and we'll pull up the Care Match site for Fullerton so we can take a look at that together. So this website here is caresolace.com/FSD parents. And this is available to students' families, staff families associated with the district. It allows you to anonymously and confidentially get matched up with providers. It does not require a login. It doesn't ask any personal information. It's completely anonymous, completely confidential, and it's very user friendly. You just step through this questionnaire and I'll do a simulated answer here for you. So let's say someone is seeking services for depression and anxiety. Those are the two most common reasons that people reach out for help to us. And then what type of treatment are you looking for? Anything from individual therapy to outpatient programs, inpatient programs, partial hospitalization, residential treatment. Well, let's say we're looking for therapy first. And then gender, so we can match based on demographics if applicable, ethnicity, and insurance. So we work with families with all types of insurance and providers that accept all types of insurance or offer sliding scale if a family does not have insurance. We do not want insurance to be a barrier. So if you have a private, if you have a private plan, we will find a provider that accepts that plan. If you have public insurance, we will help you navigate the system and find an appropriate resource. If you do not have insurance, that's okay. We'll help you find sliding scale out-of-pocket options that adjust based on income. Go ahead and enter your zip code. We can coordinate care for both in-person services and telehealth. Keep that in mind. Distance that you're willing to travel if you did want in-person services. Now you're going to get a little pop-up that says that a care companion can help you set an appointment. We really do encourage that you leverage the care companion because at no cost, they will pull that list that you're matched up with by using this reference code. They'll open a case for you and they will call these providers on your behalf to check availability, to navigate insurance. Again, make sure that they're a good fit for you, help to schedule the appointment, and follow up afterwards. So they'll do that legwork for you, make it easy, make it seamless, really streamline the process for you. You go in here to special requests, you can update some of these fields, like if you're looking for a provider that speaks a specific language. If you did want telehealth specifically, that's going to change your options as well. Of course, you can reach out to these providers on your own, but we do really encourage that you leverage the care companions because that's how we can really add a lot of value and help you throughout the process. This website can also be translated to all of these languages here in the top right corner. And under book appointment, you will see that contact information for the care companions. Again, the phone number, the video chat link, and the email that they can be contacted at 24/7. One more time, this website is caresolace.com/FSD parents. My name is Tyler. Thank you all for your time. Take care.
Thank you so much, Tyler, and thank you again for joining us. For further information, please consult the contact information at the bottom of the screen.